Welcome back. In this segment, we focus on the Fall Prevention School. Here to tell us about the program is Andreas Perez, coordinator and occupational therapist, anesthesia and physical medicine service. Welcome, Andreas.
Hey, Fred. Thank you for having me here. A pleasure.
Andreas, can you tell me a little bit about the objectives of the Fall Prevention School for veterans?
Of course, Fred. It's a new program that just started. Main goal is to help our veterans continue to be safe and independent as possible, and most importantly, promote aging in place. So it's basically educating them on how to prevent falls, because falls is one of the main reasons we see a lot of patients and a lot of veterans come into the ER, urgent care, and eventually to rehab.
How does the program promote awareness?
So the program is structured into 4 classes. We meet once a week, and each class covers a specific area or risk factor. Basically, we got 3 main risk factors: physical, environmental, and behavioral. And the goal is to teach them, make them create a little bit more of insight, help them also do a self-assessment, and eventually provide them with the tools to address those different factors.
Can you share some of the outcomes?
Yep, so far, one of the things that we like to do at the beginning of the program is to kind of help veterans establish like a baseline for themselves on how confident they feel on preventing falls. And then by the end, we also retake that questionnaire, and usually we've been seeing like after the program, they feel more confident and able to prevent falls.
And what role does the occupational therapy help veterans understand and be more aware of falls and how they can protect themselves from falls?
So one of the main roles of occupational therapists such as myself is to always enable people to continue to be independent and continue to engage in what we call occupations. For us, occupations, Fred, is all those activities that occupy your time, from basic ones like dressing, grooming, feeding, sexual intimacy, moving in and out of the house, to more complex ones like taking care of the house, yard work, driving, sleep and rest, you name it. And whenever a fall happens, it can greatly impact our ability to continue doing those tasks. So we want veterans to feel safe when doing these tasks, or if they already experience a fall, to build their confidence and have the tools, not only physically, but also mentally, on how to maneuver and stay safe.
And what are some of the risk factors of falling?
Well, per literature, the 3 main ones, the first one is physical risk factors. In particular, your health profile, any chronic conditions, any specific impairments. Sometimes also, as we age, our body naturally changes. So trying to keep a good lower body strength, core, balance, and mobility in check usually helps to prevent falls from a physical perspective. And then environmental has to do more with those things outside of us that we cannot control, but we can definitely make modifications to stay safe at home or even when in the community. And the last one is behavioral. A lot of things we do as humans can put us at risky situations. So if we can learn more about how to stay safe and the things that maybe I might be doing now that puts me at a risk of fall, can go a long way into preventing falls.
And how does your occupational therapist work and collaborate with different other organizations as far as educating, and how do you do different things together? You ever collaborate and do events together or cross-educate each other?
So that's a great question, Fred. The goal of the program also is to act as a trampoline too. At the end of the class, all the classes, I like to do a screening and then educate patients on other programs and services available just to promote health, wellness, and prevent falls. That means either referring to physical therapy or to pharmacy for a consultation, whole health services as well, recreational therapy, and you name it. Depending on whatever needs that particular veteran that participated in the program have, we try to connect them. Also, we go sometimes out in the community to sponsor this new program, so veterans learn that not only rehab, but we also have these new preventive services available for them.
Okay, and what qualifies a veteran to go to the Fall Prevention School?
So currently, part of the criteria is any veteran that's 65 years or older that has already a concern or fear of falling, has experienced at least 1 or 2 falls in this past year, or is actively working in rehab and would like to learn or go a little bit deeper more in fall prevention.
Do you have any interaction with the family as far as the progress of the particular veteran if they have fell before, or just let them know different things to watch out for with them?
So usually we do, in particular when we work more one-on-one, but even when we're working in group-based, we always encourage them to share what they're learning and the resources provided with their loved ones, so everybody can be in the same page, because family and caregivers also play a big role. A lot of veterans also are caregiving for their loved ones too, and that's another way that we can also empower them to stay safe.
Do they teach them proper lifting skills and different things like that?
We do. In particular, I have veterans that sometimes say that I would like to learn a little bit more one-on-one, and then once they're referred to either occupational therapy or physical therapy, we work on teaching them all that, like proper body mechanics, when lifting or moving furniture around the house, exercises or routines that they can incorporate to their weekly routine to stay strong and independent, or some group-based exercises like yoga, tai chi. Recreational therapy also now has a functional exercise group that we can connect them to. So just they can stay active and healthy and learn how to take care of their health.
Okay, I understand you have a new stroke program.
That is correct.
Could you elaborate on that a little?
Of course. So part of my roles is also neuro rehab coordinator in the occupational therapy realm. And right now I've been working now on creating an outpatient stroke rehab program at Lake Baldwin VA. The main goal is just to help our stroke survivors not only regain hope, but also help them regain independence, right? The main focus of the program is to promote neuroplasticity based on the principles supported by literature. So either we can remediate, which means to improve skills, or sometimes there's permanent impairments or disability, but there's still hope. We can find new ways to compensate, teach them ways to do the same activity, or even provide equipment, home modifications, amongst other interventions.
I know that there's been quite a bit of people who have had strokes since COVID. So, you know, it's just quite a bit of people, and young and old. It's not, it doesn't depend if you're older or not anymore. And there's a retired captain in the Navy that I know he told me he's participated in your program and he's very excited about it. Can you tell me a little bit about it and his progress?
Yes. So he's been doing phenomenal. He's actually a patient that started like 2 months ago. High motivation. He's kind of the role model for what stroke rehabilitation should be, right? That it's stroke rehab, it's a partnership. It's not only about me teaching the patient what to do, it's working together with the patient and their family. What are their functional goals? What occupations they want to get back? And I see myself more as a facilitator, but patients like himself, like your friend, he's doing a phenomenal job because he's committed, he's motivated, he's always looking for ways that we can support his journey, because each stroke is a journey, and I like to meet patients where they're at too. But he's been doing a phenomenal job. He also underwent a particular procedure out in the community called VV-Stem, which has kind of tripled his gain, his functional gains, significantly. And I've been able now to work with him and provide therapy after that procedure has been implanted, which is something new, and eventually we want to expand and see if more stroke survivors can enjoy of this intervention that is very promising, and it's been showing a lot of functional benefits.
And what does the implant actually do? Could you describe it a little?
So in a nutshell, it's basically an implant that goes into the vagus nerve, which kind of accelerates the neurochemicals that we need in our brain available to promote greater neuroplasticity, right? Neuroplasticity is our brain's capacity to change. There's still this belief that a chronic stroke, which is considered anything 6 months after the initial onset, change is not possible, but it is. Science is showing it. Intervention like this procedure is showing that it's still possible. And even with traditional approach, change is still possible when you hit the specific stroke rehab principles and you bring them into their sessions.
Andreas, it's been very interesting what you told us today. I really like the experience and the education that you have on it, that you're sharing with us today. And I'd like to thank you and the VA Medical Center for having you here for me to interview today.
Thank you, Fred, for this opportunity. I'm just glad to serve our veterans because they served me, and this is my way of repaying all the sacrifices they underwent to ensure our safety and freedom.
Well, thank you, Andreas. We appreciate you.
Thank you, Fred.
It is certainly good to know that right here in Central Florida, dedicated resources are in place to support our veterans on their path to healing and renewal. If you'd like more information on anything discussed in today's episode, go to www.ocfl.net/veterans. That's where you'll be able to find links and contact information you need. I hope you will join us again for Operation Outreach, as we will continue to highlight the many programs and services available to our military veterans in Central Florida. Until then, I'm Fred Robinson. Take care and thanks for watching.